Herbal and natural diabetes therapy. Numerous regular herbs and spices are professed to have glucose-lowering properties that make them helpful for individuals with or at high risk of type 2 diabetes. If you are watching this video for the first time, please kindly like this video, hit the subscribe button and click on the bell icon so that anytime I make a video like this, you will be notified. Various clinical investigations have been completed as of late that show possible connections between herbal treatments and improved blood glucose control, which has prompted an increase in individuals with diabetes utilizing these more regular cures to help deal with their condition. What herbal therapies are available? Plant-based treatments that have been shown in certain investigations to have anti-diabetic properties include aloe vera, bilberry separate, bitter melon, cinnamon, fenugreek, ginger, okra. While such treatments are normally utilized in Ayurvedic and Oriental medication for treating serious conditions, for example, diabetes, numerous health experts in the West are skeptical about their reported health advantages. Actually, in light of the fact that specific herbs, vitamins and supplements may interact with diabetes meds counting insulin, and increase their hypoglycemic effects, it is frequently argued that utilization of regular treatments could reduce blood sugars to hazardously low levels and raise the risks of different diabetes complications. Whatever your expected purposes behind utilizing these particular herbs, you should consistently talk about your plans with your primary care physician and diabetes healthcare team group first to guarantee they are all right for your condition and decide a suitable dose. Further herbal therapies. The herbs and plant derivatives recorded below have been utilized customarily by local individuals in the treatment of diabetes, in the zones wherein they develop. Many suffer from inadequate knowledge base. Allium. Allium sativum is more commonly known as garlic, and is thought to offer anti-aging properties and microcirculatory effects. Although scarcely any investigations have legitimately connected allium with insulin and blood glucose levels, results have been positive. Allium may cause a decrease in blood glucose, increase secretion and slow the degradation of insulin. Limited information is accessible however, and further trials are required. Bauhinia forficata and Myrcia uniflora. Bauhinia forficata develops in South American, and is utilized in Brazilian herbal cures. This plant has been referred to as vegetable insulin. Myrcia uniflora is likewise generally utilized in South America. Studies using the spices as tea infusions propose that their hypoglycemic effects are overrated. Coccinea indica. Coccinea indica is otherwise called the ivy gourd, and develops wild over the Indian subcontinent. Customarily utilized in Ayurvedic cures, the herb has been found to contain insulin mimetic properties, i.e., it mimics the function of insulin. Critical changes in glycemic control have been accounted for in studies including Coccinea indicans, and specialists accept that it ought to be studied further. Ficus carica. Ficus caricum, or fig leaf, is notable as a diabetic cure in Spain and southwestern Europe, yet its active ingredient is unknown. A few investigations on animals propose that fig leaf facilitates glucose take-up. The adequacy of the plant is, however, at present yet to be approved in the treatment of diabetes. Ginseng. Ginseng is an aggregate name for a wide range of plant species. In certain investigations using American ginseng, decrease in fasting blood glucose were reported. Varieties include Korean ginseng, Siberian ginseng, American ginseng and Japanese ginseng. In certain fields the plant, especially the Panax species, are hailed as cure-all. As is the situation with huge numbers of the herbs utilized far and wide in the treatment of diabetics, further long-term studies are expected to check the adequacy of ginseng. Gymnema sylvester. Gymnema sylvester is additionally utilized in conventional Ayurvedic medication. The plant develops in the tropical woodlands of southern and central India, and has been connected with significant blood glucose lowering. Some investigations in animals have even reported regeneration of islet cells and an increase in beta cell work. Mamordica charantia. Mamordica charantia goes under a variety of names and is local to certain regions of Asia, India, Africa and South America. Showcased as charantia, it is otherwise called corella or corolla and bitter melon. The herb might be prepared in a variety of ways, and might be able to assist diabetics with insulin secretion, glucose oxidation and other processes. Intense impacts on blood glucose levels have additionally been reported. Ocimum sanctum. Ocimum sanctum is a spice utilized in conventional Ayurvedic practices, and is usually known as holy basil. A controlled clinical preliminary indicated a constructive outcome on postprandial and fasting glucose, and specialists foresee that the herb could improve the working of beta cells and encourage the insulin secretion process. Apuntia streptacantha. Apuntia streptacantha nopal is ordinarily known as the thorny pear desert flora in the parched districts where it develops. Occupants of the Mexican desert have generally utilized the plant in glucose control. Intestinal glucose take-up might be influenced by certain properties of the plant, and animal studies have discovered noteworthy decrease in postprandial glucose and HbA1c. Indeed, to approve the thorny pear desert plant as a viable method for helping diabetic patients, long-term clinical trials are required. Silibum marianum. Silibum marianum is otherwise called milkthorn, and is an individual from the aster family. Silymarin contains high convergences of flavonoids and cancer prevention agents, some of which may beneficially affect insulin resistance. The job of milkthorn in glycemic control is little understood. Trigonellaphoenumgraecum. Trigonella phenum graecum is known as fenugreek and is broadly developed in India, North African, and parts of the Mediterranean. It is additionally a piece of Ayurvedic treatment, and is utilized broadly in cooking. Of the couple of non-controlled trials that have been done on type 2 diabetics, most reported improved glycemic control. Further examination is unquestionably justified. Further spices that have been considered, and may have beneficial outcomes for diabetic patients include berberine, Cinnamomum tamala, curry, Eugenia jambalana, ginkgo, Philanthus amarus, Pterocarpus marsupium, Solanum torvum and Vinca rosea. For more information about how to best manage diabetes, I have left a link below, you might want to check it out. Thank you for watching.